Welcome to this EuroPCR wrap-up focusing on transcatheter mitral and tricuspid regurgitation therapies. My name is Nicolas van Mieghem from the Erasmus University Medical Center in Rotterdam, and it's a great pleasure to be joined by Professor Philipp Loerts from the Heart Center in Leipzig and Professor Philipp Rake from Heidelberg University to discuss what is new or new insights and findings on the treatment of TR and MR with transcatheter therapies. This is a session sponsored by Edwards Life Sciences and brought to you by Radcliffe Cardiology. And we will have 3 parts in this program. In the first part, we'll focus on the introduction of the Edwards portfolio, and then we'll zoom into the data that have been presented at EuroPCR. So without further ado, I'd like to start with a brief introduction. And there is quite some attention and attraction also for Edwards Life Sciences technologies at EuroPCR in the treatment of MR and TR. We have 4 late-breaking trials, 4 abstracts. There is also a tools and techniques session and also expert interviews. So quite a lot of attention to these new technologies. And Edwards Life Sciences started already with their activities in this field in 2015 by introducing the Cardioband. It followed in 2019 by the Pascal system. In 2020, we had the release of Pascal Ace. And Edwards is also developing and studying new technologies like transcatheter mitral and tricuspid valve replacement. We'll get to that at a later stage. So there are 5 pivotal studies now focusing on how to treat MR and TR with these technologies. We have the CLASP family of trials evaluating the Pascal system, both in the tricuspid space, but also for degenerative and functional mitral regurgitation. There is also the TriScent that had a presentation at EuroPCR focusing on the EVOC transcatheter replacement system, in this case for tricuspid regurgitation. And there is also the Encircle program with the 3M replacement system. There are 4 early feasibility studies with EVOC, Cardioband, SAPIEN M3 and EVOC. And then there are also 4 post-market studies. So a lot of scientific background to illustrate how these devices may help patients with severe TR and MR. So I guess this would wrap up my introduction, but I have a couple of questions, or maybe one major question for Professor Loerts and Professor Rake. What were you looking forward to at EuroPCR when you look at these technologies? So Professor Loerts.
I was and still am extremely excited to hear about the latest results of the, I'd say, the newest kit on the block, which is the EVOC system for transcatheter tricuspid valve replacement. Really extremely promising results, and I think we will hear much more about that.
And Professor Rake, what is your take?
Thank you. I'm really curious on was really curious on the CLASP 2-year results, which was the Pascal system for mitral regurgitation, which showed really a sustainable and durable result over 2 years, which I think is really important for our patients, that when we implant these devices, that we get a durable result for the patient. And I think that's really important, and I really like these results.
So, okay, I echo those sentiments. So without further ado, let's dive into part 2 and 3 to focus on more results.